Hi, everyone. This is Crystal Cargis here for Eating Disorder Hope. And today I just wanted to discuss a really important topic that I think a lot of women struggle with, and this is postpartum depression. And I am also a mother of three little ones, and this is something that I definitely understand. And I think it's important that as a community, we continue to raise awareness about this struggle that so many women go through. And I think the more that we can talk about it, the easier it is for people to realize that it's okay if you're experiencing postpartum depression. It kind of helps break a lot of the stigma that comes with this disorder, which is important if you want to receive help and treatment. For women who have bulimia or who have recovered from bulimia, may be at increased risk for developing postpartum depression after delivering their baby. And not a lot of women know that necessarily, that, if you've had an eating disorder like bulimia or anorexia, that you actually are at increased risk of having postpartum depression. It's really important to know and be aware of the symptoms of postpartum depression. And it does happen after delivery, so it can be, anywhere from a couple days afterwards, but usually the symptoms of postpartum depression last for about a couple weeks. And if they're not improving, that might be a clue to you that it is in fact postpartum depression and not just, a mood swing or anything like that. But typically, symptoms of postpartum depression include severe mood swings, anxiety. You can have a loss of interest in activities that you used to enjoy. You can have a loss of appetite or just a loss of interest in food, insomnia. Some women with postpartum depression might actually have anger or frustration or feel really intense guilt, which can be really hard to deal with. Some women might feel like they are in danger of hurting themselves or their baby. It may be hard to connect or bond with a new baby. And, the first few months after having a baby are just very intense and overwhelming. And there's so many different things that a woman is learning and adapting to. And it can be normal to experience some of these feelings, but when it comes to the point where you just can't complete your daily tasks that you used to do, or you just feel like you're going to hurt yourself or you want to hurt your baby, that's not normal. And that could very well be postpartum depression. And it's important to know that there are a ton of great resources to help any woman who may be struggling or dealing with postpartum depression. And the most important thing that you can do is reach out and ask for help. It can be so overwhelming in those first moments of having a baby, that critical time period when you have a newborn. There's just so much going on, and you're recovering from birth physically, and you're learning how to take care of this new baby and managing a household, and some women are going back to work right away. So there's a lot going on, and sometimes we put ourselves last in terms of taking care of ourselves. So the first thing that you can do to help yourself get through this is to really reach out and talk to someone that you trust and that you can confide in. A really great resource too would be your OBGYN, who most of our OBGYNs are specialized in knowing the symptoms of postpartum depression and can really direct you to resources that can help you recover. And those days just might feel so dark and so despairing, but it is important to know that there is hope and there is healing and that you can recover from postpartum depression. For some women, it takes longer than others, but through different treatment options, you can find what works best for you and get well and be able to really take care of yourself and take care of your baby and be the mother that you are capable of being. So I hope this message brings any mother out there who's struggling with postpartum depression some hope, to know that you're not alone and that you're doing an amazing job as a mother. It's probably the greatest responsibility and job that any person can have. And there's hope for you, so don't be afraid to reach out for the help you need. Thank you so much for listening, and feel free to visit eatingdisorderhope.com for some more great resources on bulimia and postpartum depression. Thanks, everyone.